Okay, this is my bag with lots of other medicines, with supplements too. They're not all drugs. That's an empty bottle. I'm probably going to encounter a lot of it. Omega-3 fatty acids, because they really help your overall health. Everybody should be on them, not just sick people. Magnesium. This is something called blabbity. It's actually mostly made of earthworms, and it sort of helps your circulation and helps clean the blood. This is just turmeric. A lot of people that have Lyme disease are on that, and I'm not really sure why they use it as a supplement. It does something. I think I would be more educated if I'm not. Interphase is an enzyme that helps with absorption. Iodine. Another thing for breathing and allergies. Folate. That's just more aspirin. That's just more painkillers. Iron. Pectisol. Pantothenic acid. And then I have two other dailies that are supplemental. One's like a bicillin, which is like an acidophilus to help contradict a lot of the things that are sort of harsh in your system and prevent, I'm sure, yeast growth and tummy upset. And then these are really great. I have a very upset stomach a lot of the time, and they are an all-natural sort of, it says relief of stomach acidity, heartburn, and acid indigestion, but I get just tummy pain, and I have a lot of bone pain with my Lyme, a lot of Lyme arthritis where in my knees and hands they always hurt, and some days there's sort of a weakness to them too, so I can't get out of bed and I have to sort of crawl across the floor as opposed to stand, just because my knee joints, I don't have as much trouble with my hips like some people do, but my knee joints can't take it. And then the source of my number one source of like intense pain is my entire spine. Between every vertebrae, it's sort of like on each side between every vertebrae, somebody's taken knives and shoved them in between each vertebrae, and then so there's a sharp pain and then there's an ache too. And when you have that every day, it can sort of get debilitating. Thusly, this pain medication and some of the pain medications I have in my medicine cabinet. I lost my train of thought. Pain. The stomach stuff. Whenever I have anything just normal with everybody that happens, indigestion or a common cold or sneeze or the hiccups, because I experience such intense bone pain, it just makes it 1,000 times worse. And a sneeze can go from something that doesn't bother you very much to something that's completely and utterly debilitating. Okay, also, I take, this is Mepron. It's an anti-malarial drug. People use it to treat malaria, or sometimes I think they take it ahead of time to prevent malaria. This is something that's addressing some of the things that are going on in my body. I only take this because it's strong. I take it every fourth day, 2 teaspoons. And along with that, I take something called artemisinin, which is a herbal thing. It's not a pharmaceutical, but it's basically it's wormwood. It's a poison that's helping kill stuff. That is one of the drugs that I react the strongest to. I sort of have some hallucinations, visual hallucinations, bells, usually. I'm not really sure why. You watch an old Western and the school marm had a bell, a hand bell that she rang to indicate the class was going to begin. And that's what I hallucinate. I don't collect bells or have a lot of bells in my house. But I hallucinate bells, so I'll start off seeing one bell and then they sort of multiply. I also hallucinate bugs crawling places or their floaters. And then I have oral hallucinations where you hear like a telephone ring. For a long time before I started treatment, I was hearing girls screaming. I think that was my just response to sort of everyday pain. It was like a imagined expression of my frustration and pain. So herxing. When I take the Mepron and artemisinin, they say that you're supposed to herx and be really sleepy. I'm not sleepy at all, actually. The opposite happens usually. I have some intense insomnia. It's not that I can't. Well, I can't sleep for a long time, for hours and hours, but then once I fall asleep, I can stay asleep. I'm not somebody that wakes up all the time. But when I'm having that, I can go 2 days. Is that right? Is that accurate? Maybe not a full 2 days, 36 hours without sleeping, and then I crash. And one of two things happen. I can either sleep for like 3 hours, which I don't understand, and it sort of then, of course, progressively makes me sicker, or I sleep for 12, which is wonderful and a blessing. Some other things that can happen when I'm herxing, which are not on the days I take the Mepron and the art. I sort of wait. I'm on a cycle, like I take it every 4 days, and every third day out from taking it is when I sort of really have some serious symptoms, usually. And I get really ticky, where my shoulders sort of jerk. I've seen a lot of people have really severe herx reactions that are neurological, and I'm sort of very lucky in the fact that mine are like this kind of thing. I don't have a whole hand that pops up now. Maybe that'll come later in my treatment, or maybe I'm just fortunate. And the bone pain will get really intense, and the hallucinations, and the weariness, and it's there are occasional seizures. Yeah, so that's it for now, I think. I want to go back and look at this footage and see if I think it'll be useful in any way. But yeah, treating the babesia now. It's sort of a really long road, and anybody out there that's dealing with this or any other kind of chronic illness, like, I've been sick for a really long time and could never find it. And so it's sort of, I feel really lucky to have been diagnosed. So if you're someone out there chronically ill and you don't know what it is and you can't get help and you've heard doctors tell you that you're crazy or you've been misdiagnosed, maybe you should look into getting tested for Lyme disease or seeing a vector-borne illness specialist. Because even though sort of it gets worse because the treatment makes you feel worse, at least you don't feel crazy anymore. Okay.